Most people who come to me with elevated inflammatory markers are not eating fast food every day. They are not drinking soda with every meal. They are doing what they believe is the right thing, and their body is still quietly on fire. That is the part nobody talks about. The habits driving dangerous inflammation in your body are often the ones you do not expect, even recognize as habits. They feel like life. And that is exactly what makes them so hard to catch. What I am going to show you in this video are 7 habits that the evidence consistently links to dangerous, systemic, low-grade inflammation, and more importantly, what to do instead of each one. I think you are going to recognize at least 3 of these in your own daily routine. Most of my patients do. And most of them had no idea. Before we get into the list, I want to make sure you understand what we are actually talking about when we say dangerous inflammation. Picture the red, hot, swollen skin around an insect bite. That is acute inflammation, your immune system doing its job, localized, temporary. Now imagine that same process running at about 5% of that intensity, but instead of one spot on your skin, it is running through every blood vessel, every organ, your gut lining, your brain, your heart, simultaneously, continuously, for years. That is chronic low-grade inflammation. It does not hurt. It does not announce itself. But it is, right now, one of the most common threads running through heart disease, type 2 diabetes, stroke, dementia, and a growing list of gut-related conditions. A review published in the journal Nursing for Women's Health examined the relationship between dietary and lifestyle habits and inflammatory disorders, and found that chronic low-grade inflammation underpins nearly every major Western disease category we face today. This is not a minor finding, and the habits feeding it are not what most people expect. So let us talk about what is actually driving it. Habit number 1, eating on a disrupted schedule. I do not mean eating the wrong foods, I mean eating at inconsistent times. Skipping breakfast until noon, eating your largest meal 2 hours before bed, working through lunch, and compensating at 10 at night. This is one of the most underappreciated inflammation drivers I see in clinical practice, and it is almost never discussed. Here is the mechanism. Your gut has its own internal clock, what researchers call the intestinal circadian rhythm, and it is tied directly to the production of mucus, digestive enzymes, and the balance of bacteria in your microbiome. When you eat out of sync with that clock consistently, a process called intestinal dysbiosis begins, where the ratio of beneficial to harmful bacteria shifts. And research examining the metabolic nature of inflammatory gut conditions published in Nature Reviews Gastroenterology and Hepatology identified that excessive intake of specific macronutrients at the wrong biological timing can directly activate innate immune sensors in the gut lining, triggering an inflammatory cascade that reaches far beyond the intestine. The gut does not operate on your schedule. It operates on a clock that was set long before you started working late. What to do instead? Eat within a consistent window. Not a perfect window, a consistent one. Your gut bacteria respond to timing more than quantity. Even shifting your last meal 30 minutes earlier each day for 2 weeks has been shown to produce measurable reductions in gut-driven inflammatory markers. Habit number 2, sitting for more than 8 consecutive hours. Not sitting in total, sitting without interruption. This distinction matters enormously, and most people miss it entirely. Prolonged uninterrupted sitting reduces blood flow to the gut by a measurable amount, which decreases the delivery of oxygen and nutrients to the intestinal lining. When the gut lining is undersupplied, it becomes more permeable, a process commonly referred to as increased intestinal permeability. Once that lining becomes permeable, bacterial fragments called lipopolysaccharides can pass through into general circulation. And lipopolysaccharides are, without question, one of the most potent triggers of systemic inflammation in the human body. They activate the same immune pathways your body uses to fight a bacterial infection. Except there is no infection, just chronic, low-level immune activation running silently in the background. What to do instead? The research does not ask you to exercise. It asks you to interrupt. 2 to 3 minutes of walking, standing, or light movement every 6 to 9 minutes appears to be sufficient to maintain gut wall integrity and significantly reduce our inflammatory markers in the blood. Set a timer. That is the entire protocol. Habit number 3, getting fewer than 6 hours of sleep regularly. Sleep is the most underestimated anti-inflammatory tool your body has. During deep sleep, your brain and your gut both undergo active repair processes. The gut microbiome is regulated in part by the same circadian signals that govern sleep. When you cut sleep short on a regular basis, and by regularly I mean more than 3 nights per week, it has consequences. You measurably suppress the bacteria responsible for producing short-chain fatty acids, and particularly butyrate. Butyrate is the main fuel source for the cells that line your colon, and one of the most potent anti-inflammatory compounds your gut produces naturally. Less sleep, less butyrate, thinner gut lining, more permeability, more inflammation. This is a chain reaction, not a coincidence. I know what you are thinking right now. You are thinking, I have always been a poor sleeper, and I feel fine. Let me be honest here. The absence of symptoms is not the same as the absence of inflammation. These markers rise silently. The patients I see with the most severely elevated inflammatory panels are often not tired, not in pain, not aware that anything is wrong. They are just reliably getting 5.5 hours a night, year after year. What to do instead? The gut-specific intervention here is temperature. Research consistently shows that sleeping in a room between 60 and 67 degrees Fahrenheit increases the proportion of deep, slow-wave sleep, which is the phase most directly correlated with gut microbiome repair and reduced overnight inflammatory markers. This costs nothing and has 0 side effects. Before I get to habit number 4, I need to show you something that connects everything we have covered so far. Because once you understand this single mechanism, the rest of this list is going to land very differently. Every habit I have described shares one downstream consequence: increased intestinal permeability. Disrupted eating timing increases it. Prolonged sitting increases it. Poor sleep increases it. And when the gut lining becomes permeable, it becomes the single most important source of systemic inflammation in your entire body. Your gut is not just where digestion happens. It is where your immune system makes a continuous decision about whether the contents of your intestine are safe or dangerous. When that barrier is compromised, that decision gets made wrong, constantly. And the inflammatory signal it sends does not stay in the gut. It travels to your joints, to your brain, to your cardiovascular system. That is the mechanism connecting these habits to the diseases you are probably already trying to prevent. Keep that in mind as we go through the next 4. Habit number 4, eating ultra-processed food daily, even in small amounts. I want to be specific here because I am not talking about the occasional biscuit or the Saturday pizza. I'm talking about daily consumption of foods containing emulsifiers, the additives used to give processed food its smooth, stable, palatable texture. Carboxymethylcellulose and polysorbate 80 are the 2 most studied. And what the research has found is striking. These emulsifiers directly disrupt the mucus layer lining your intestinal wall, the protective barrier between your gut bacteria and the epithelial cells underneath. A thinned mucus layer means bacteria that should remain in the lumen of the gut are now in direct contact with the tissue below. And that contact is inflammatory by design. The gut immune system is not built to tolerate direct bacterial contact. It is built to respond to it. The research also notes that specific processed food components directly exploit innate immunity sensors in the gut, generating an inflammatory signal that mirrors what we see in early-stage inflammatory bowel disease. This happens at daily exposure levels, not extreme ones. What to do instead? The evidence consistently points to whole foods with intact fiber, not fiber supplements, but fiber as it exists and inside actual vegetables, legumes, and whole grains. That fiber feeds the bacteria that produce butyrate, which repairs the mucus layer. The replacement is that direct. Habit number 5, drinking alcohol regularly, even moderately. This is the habit most people want to argue with me about. So I am going to give you the mechanism and let you make your own decision. Alcohol increases intestinal permeability within 24 hours of consumption, not heavy drinking, any alcohol. The mechanism is direct. Ethanol and its primary metabolite are toxic to the tight junction proteins that hold gut epithelial cells together. When those tight junctions loosen, lipopolysaccharide leakage increases. Additionally, alcohol selectively suppresses the bacteria that produce butyrate while promoting the growth of gram-negative bacteria, precisely the bacteria whose cell walls contain the highest concentrations of lipopolysaccharide. So the gut lining becomes more permeable. At exactly the moment the organisms most capable of driving inflammation through that permeable lining become more abundant. Both things happen simultaneously, every time. I am not telling you never to drink. I am telling you what happens in your gut when you do. And the patients who remove alcohol from their routine for 60 days consistently show the most significant reductions in inflammatory markers of any single lifestyle change I track in clinical practice. What to do instead if you want a replacement that actively reduces inflammation via the gut. The evidence is clearest for fermented beverages containing live cultures, kombucha being the most studied, or polyphenol-rich drinks like green tea or hibiscus, both of which have documented anti-inflammatory effects at the gut epithelium level. Habit number 6, living with chronic psychological stress and giving it no physical outlet. Stress is an inflammation driver in its own right, and the mechanism runs directly through the gut in a way that most people, including most doctors, do not fully appreciate. Your gut contains approximately 100 million neurons, more than your spinal cord. It communicates bidirectionally with your brain, through the vagus nerve and through a network called the enteric nervous system. When your brain perceives chronic psychological stress, it signals the gut through that same network to increase intestinal permeability. Cortisol, the primary stress hormone, directly degrades the tight junction proteins in the gut lining, the same proteins that alcohol degrades, the same proteins that poor sleep fails to repair. So every source of chronic cortisol elevation is also a source of gut barrier dysfunction, and therefore a source of systemic inflammation. Here is what makes this particularly important. Psychological stress activates the inflammatory cascade even when your diet is perfect. I have patients who eat extraordinarily well, sleep adequately, and still present with elevated CRP and interleukin-6. And when we talk about their lives, the common thread is unmanaged chronic stress. The gut does not distinguish between a dietary insult and a psychological one. Both arrive at the same lining and both produce the same result. What to do instead? The physical outlet matters here because it closes the stress-gut loop through a specific mechanism. Physical movement, even a 20-minute walk, activates the vagus nerve directly, reduces circulating cortisol, and measurably restores tight junction integrity in the gut lining. The gut wall responds to your nervous system faster than it responds to your diet. That is not a motivational statement. That is the physiology. Habit number 7, never eating fermented foods. This is the one that most people do not think of as a habit at all. You are not doing something harmful. You are simply not doing something your gut was designed to receive every single day. Before industrialization, and I mean before the last 80 years, not ancient history, fermented foods were a daily constant in human eating, across virtually every culture on Earth. Not because people knew about the microbiome, because fermentation was how food was preserved. Live bacterial cultures, short-chain fatty acids, and postbiotics from fermented sources were continuous inputs to the gut microbiome throughout a person's entire life. That daily input shaped a gut environment that was, by default, far more resistant to inflammatory signaling than what we carry today. The Anti-Inflammatory Diet Review, published in Nursing for Women's Health, identified consistent fermented food consumption as one of the most reliably anti-inflammatory dietary behaviors across multiple adult populations studied. And what is significant is not just that fermented foods add something beneficial. It is that their absence removes something the gut lining depends on for ongoing structural maintenance. The bacteria that produce butyrate, that repair the mucus layer, that regulate immune tone in the gut, they require regular feeding from fermented and fiber-rich sources. When that feeding stops, the infrastructure deteriorates quietly, not dramatically, just consistently over years. What to do instead? The target is consistency, not quantity. A small daily serving of live culture yogurt, kefir, kimchi, sauerkraut, or kombucha delivers more microbiome benefit than an occasional large serving. The gut bacteria that receive these cultures respond to regularity. That is how they were always meant to be fed. Here is how I would actually approach this if I were starting. So from where most of my patients start. I would not try to fix all 7 habits at once. I would look at this list honestly, find the one where I recognized myself most clearly, the one that felt uncomfortably familiar. 3 weeks is enough time for measurable shifts in bacterial populations. 3 months is enough time for measurable shifts, and I would change only that one for 3 weeks, because the gut microbiome responds to sustained behavioral change, not to one-day clean slates. In the inflammatory markers, your doctor can actually see on a blood test. And I want to close the wager. As I made at the beginning of this video, I said that by habit 5, you would recognize at least 3 of these. I want you to understand something. That is not a failure. That is information. The habits driving dangerous inflammation. In your body are the things you do every day, on repeat, without thinking, and the things you do on repeat in your own routine. If you are sitting here having counted 3, 4, or 5 of these habits in your own life, are also the things you have the most power to change. Starting with 1. If this video gave you a framework you did not have before, there is another video on this channel that goes deeper into exactly how your gut lining works and what the evidence says about repairing it. I would recommend watching that next. Take care of your gut, and does not constitute a medical advice. Consult your physician before changing any supplement, dietary, or lifestyle protocol. It is taking care of a great deal more than you realize. This video is for educational purposes only.